What up, guys? Brent here, and my cat. Um, just wanted to make a video talking about why I chose Meta. So, I weighed out for a long time the pros and cons. Now, I've been transitioning for a long time. June will be 10 years on testosterone. I came out as transgender November of 2008, and I started testosterone June of 2009. So June will be 10 years. At the time, surgery wasn't that great, to be honest with you. It's really come a long way. Now, Meta existed, Meta was a thing, but at the time I didn't know how my growth would turn out. And Fallow was just, the results weren't that great, in my opinion. Now, the results are phenomenal, in my opinion. I would go as far as to say phenomenal. I have seen really, really good results. With that said, as with all surgeries, there's complications. There's complications for, there's risks. There's risks for complications, whether it just be bad healing or, problems with the healing, infections, etc. So when it comes to Fallow and it comes to Meta, I weighed out my options. Because like I said, I love Fallow. And I am getting I love the results of Fallow. And I am getting surgery. I'm getting my consultation with Dr. Bluebond Lagner at NYU Langone. Now, she does FTMs, she does MTF surgery. Matter of fact, I just have an MTF friend who got lower surgery with her, got SRS with her. But she prefers Fallow from what I hear, but she does do Meta. Now, I'm going with her for reasons I'll explain in another video, and I'll see what she says in the consultation. But I feel pretty confident that that's who I want as my surgeon. And so why did I choose Meta after thinking about this for a long time? Because there's a lot of pros to Meta, but the con is a big one. And the con is the size. I really like the aesthetic of Fallow. Now, lots of guys, or a couple guys at least that I've talked to, let's put it that way, I don't know how many. I'll let you enjoy the view of my cat. Shiloh, yeah, say hello. Say hello, Shiloh. Oh, we got the jealous dog. Gigi, come here. Come on. Gigi, jealous? Well, she's not going to come here. She's a little camera shy. But you got Shiloh. So why did I choose Meta? So I like the aesthetic of Fallow. Guys I have talked to can have sex just wrapping it up without the erectile device, although most guys want an erectile device. But the main reason I chose Meta is because I have pretty good growth now. I like what I have now. I like playing with what I have now, to be blunt. I'm not going to go into details in this video, but I enjoy my anatomy now. Now, having a micro penis, is that going to be difficult? I mean, it's going to be different, but it is what it is. I'm different. That's the way I see it. So pros, better healing time. You don't have a scar on your arm or on your leg, and not only just a scar, but another place where infection could occur, although unlikely. I have not heard too much about it. But at the same time, Fallow is a longer procedure, and these are my reasons for choosing Meta. Fallow is a longer procedure, and there's more risks that things can go wrong, more chances of things going wrong, and then you don't have the natural erections. I do like the natural erections that I have now. I think I'd be really happy with that with Meta. So those are really my main reasons. Better healing time, natural erections, enjoying my anatomy now, having full sensation, although from what I hear, when it comes to Fallow, your natural penis is buried in the phallus. So you can still feel that. You can still feel that at the base. So it's not like I wouldn't have that, and that's another reason, like, I'm cool either way. If I go into my consultation and she says, hey, I don't think you're going to be able to STP, I don't think you're a good candidate for Meta, totally cool with Fallow. Although I do think I'll be a good candidate because I do have really good size. Fortunately. So that's genetics. Also pumping. I did pump a little bit in the beginning, and I'll probably do that. Actually, I will do that. There's really no reason for me not to get back on that. So, yeah, those are my reasons for choosing Meta. To recap once again, shorter healing time, less chance of, still have risk of complications, but not as high risk, not as many risks as fallow. I like my size. I like my anatomy now. I like the natural erections. I think really I'll just be comfortable with everything being closed up, the skin being removed, and some balls, baby. To be blunt, but that's really what I want, what I think I'll be comfortable with, and I look forward to the road ahead. I'll keep you guys posted. If there's any questions you have for me at all regarding anything, drop them below. I'm going to make this series on my journey to lower surgery for you guys to document it, to put it out there, and then once all is said and done, I'm going to put all my videos on private and leave YouTube. I don't identify as a trans man. I've said this numerous times, and I just want to live my life as the man I am. So I'm here to help the community. I'll never deny being trans either. I don't think everybody who asks a blunt question deserves, an answer, right? Like, I don't have to be like, just because someone says, "Are you trans?" I don't have to be like, "Yeah, I am." But at the time and place, there's no shame to my game. It is who I am. I will tell girlfriends, of course, moving forward. I probably will tell close friends because there's a whole history behind it, and it is important to have that education out there. In my opinion, it's important to educate and let people know, hey, we exist, but we're cool. We're not any different from you, and I think that's just important for people to know. Hey, we're all the same, regardless of what we look like, regardless of how we act, regardless of our sexual preference, regardless of our religious belief, our political belief, regardless of our opinions. We're all human at the end of the day. And I just think that's important to express. So with that said, I'll never deny I'm trans, but I'm just going to go live my life. So anything you want to know, drop it below. I'll make videos about it. And when all this is said and done, I'll see ya. And for now, I'll see ya.